Hello and welcome to the Pediatric Network. My name is Mike Marinas. I am your host here for everything pediatric. So today we are going to be speaking with Dr. Vandana Patel. How are you, Doc?
I'm good. How are you, doctor?
I'm doing very, very well. So we're going to be talking today with Doc about hypotonia. But first, let me give you a little bit of a background as to who it is that we're speaking with. So Dr. Vandana Patel has a master's in Neurosciences, Pediatrics. She's an assistant professor at SS Agrawal Physiotherapy and Medical Care Education. She's also a blogger, and she blogs at tinyyears.blogspot.com, and I urge you to go and check out that blog. There is some phenomenal stuff there. She talks about Wilson syndrome. She talks about congenital hand development issues, developmental coordination disorder, which was one that really got me. One that she does talk about is hypotonia, which is what we're about to talk about today. So thank you very much for joining us, Doc.
Thank you so much. First, if we know what is muscle tone, then it would be better to understand the abnormalities which happens in like hypotonia or hypotonia or whatever you take as a dystonia. Okay, so there are these three categories that can happen if the muscle tone is abnormal. Okay, so first of all, what is muscle tone? Muscle tone is nothing but a passive resistance which is felt by the muscle. Okay, so in the normal stage, when the muscle is resting, there is some kind of a passive muscle resistance been felt in all the muscles present over the body, right? Now, whenever there is some abnormality which is going at the CNS, that is the central nervous system level, or your peripheral nervous system level, your muscle tones might get deferred, okay? And there are three categories that can happen. That is your hypertonia, that is your hypotonia, or your dystonia can happen. What is hypertonia? I would discuss in a brief regarding hypertonia. So whenever your pyramidal system, that is the one kind of a CNS, part of a CNS which is related for the fluctuating the tone, and that is called as the cerebral cortex. Okay, so that's the pyramidal system which is involved when there is hypertonicity. Hypertonicity is nothing but increase in the tone of a muscle, so your muscle feels tight, or the muscle feel rigid. Okay, so that is like increase in the tone of a muscle. Coming to today's topic, that is hypotonia, and hypotonia is related to the extrapyramidal system of the body, okay, of your CNS. So what is the extrapyramidal system? Particularly your cerebellum, that's the part of a brain which is involved when the child or when the adult ends up having hypotonia. Okay, hypotonia is nothing but reduction in the muscle tone. So in this kind of a condition, what you feel is there is less kind of a muscle resistance, which is lesser compared to the normal resistance, and which is not normally seen in most of the population. Currently, hypotonia is worldwide issue, and most of the kids are affected with the hypotonia in the category of cerebral palsy. Yesterday it was a national cerebral palsy day for India. Okay, so it is wonderful to talk regarding cerebral palsy over here, and the specific type of cerebral palsy which is related to the hypotonia, that is hypotonic cerebral palsy, in which the children end up having the muscles which are flaccid in tone, which are leg or low in tone, and because of that they end up having postural instabilities. Okay, reduction in the tone can be because of multiple reasons. It can be because of the problem in your central nervous system, or it can be a problem in your peripheral nervous system. Okay, so depending upon the hypotonia, or the involvement of a brain structure or the bodily structure, the hypotonia can be divided into three types. Okay, so here we'll discuss some three types, which is the commonest type of a neonatal hypotonia. So the first one is the central hypotonia, and that's the most common one, I would say. And in central hypotonia, you will see the involvement in the brain structures, brainstem structures, or your spinal cord structures. Okay, basically what happens is, in the extrapyramidal system, the cerebellum is the major area which is concerned about the tone of muscle. Okay, so So what happens whenever there is a deep nuclei of the cerebellum, which is involved, that time that muscle tone will go for reduction in a tone. Okay, now exactly what happens is, I'll teach you in a brief, like what is the exact mechanism that happens at the brain level. So in extrapyramidal system, the deep nuclei of the cerebellum, which is responsible for maintaining the tone. How? So first of all, there is a stretch reflex at the muscular level, at the peripheral system level. So this stretch reflex will send the afferent inputs to your cerebellum. Now, the cerebellum will fine tune your movement, and it will control the tone of a muscle, and then it will send the efferent output to your fusiomotor system. Fusiomotor system is nothing but your extrafusal muscle fibers. Okay, so once these muscle fibers are getting contracted or getting input from the cerebellar system, they will start showing the tone, that is the resistance to your passive movement. Okay, now whenever this deep nuclei in the cerebellum, they are affected, they cannot send the input, or they cannot send the output to your stretch reflex. Are you getting it? So what happens is, when this circuitry, that is the cerebellocortical circuitry, that is affected, that time you will see the low muscular tone, that is the lesser resistance to your muscle tone. This is the proper neurophysiology that happens at the brain level. Okay, and when this thing gets affected, that kind of a hypotonia is termed as central hypotonia. That is, the CNS or the CNS structures are affected, so that is called as central hypotonia. And this is the most commonest type that you see in the kids. And hypotonic CP is the one of the example of central hypotonia, in which the hypotonicity of a muscle will be very, very less. You can say it is a mild kind of a hypotonicity, but at the same time, the primitive reflexes, that is the developmental reflexes which are there, they will be affected, as well as the typical feature that on observation you can notice is thumb in. Okay, thumb palm thumb in the palm attitude. Okay, so this is the very clinical, clinically evident observational feature for your hypotonia, that is particularly for the central hypotonia. So what happens when the child is seen with the thumb in attitude? Okay, and the reflexes, that is your deep tendon reflexes, is hyperactive, or it can be normal also. Okay, so if you are seeing any symptoms out of this and the child has hypotonia on passive movement, you can term that child hypotonic child, or else a central hypotonic child. Okay, this is the commonest type which is prevalent. And what is the difference between the central hypotonia and the peripheral hypotonia? If I would like to emphasize upon that, then the peripheral hypotonia is when your peripheral nervous system, you can say when your nerves are affected, when your muscles are affected, or when your neuromuscular junctions that are affected. Okay, so this can happen in any kind of a nerve injury, or this can happen following hypoxic ischemic encephalopathy also, which is the commonest condition again. Okay, but this is the commonest feature for any kind of a muscular dystrophies. Okay, so again, along with the central hypotonia, peripheral hypotonia is also prevalent or also easily seen in the society, but compared to the central hypotonia, peripheral hypotonia is comparatively less and a rare kind of a condition. Okay, now if we talk about the difference in the symptoms in both of this, then the central hypotonia, as I said, the reflexes might be hyperactive or it can be normal, but here it will be underactive. Okay, so the deep tendon reflexes, if we talk about here, it would be very, very less or underactive. The commonest feature that you will observe here in the peripheral kind of a hypotonia, that is nothing but your fasciculation. Okay, so muscle fasciculation is, kind of an involuntary movement which is seen on the muscle belly or part muscle area. That fasciculation is the characteristic feature for your peripheral hypotonia. Now there is third category of a hypotonia, which is called as a mixed kind of a hypotonia, where you see the symptoms of central hypotonia also, and you see the symptoms of peripheral hypotonia also. Okay, so these mixed hypotonia is basically seen when there is lysosomal underactivity or malformation kind of system which is affected. That time you will see the mixed kind of hypotonia. Okay, so this is the broad classification for your hypotonia. Coming to the symptoms that you will notice when the child has hypotonia. So basically, because of the low tone in the muscle, the child is not able to resist the gravitational force which is coming on the body. That's the commonest and the most difficult complaint which is coming from the parents, that the child is not able to sit, the child is not able to stand, the child is not able to walk. Okay, so these are the activities which in which the child has to fire the muscle anti-gravity, right? And these kids will have problem with the anti-gravity control basically. So that's why the commonest complaint is they are not able to resist, or they are not able to protect their body against gravity. Understanding. Next is there would be postural instabilities. Okay, the muscles are not able to fire, the muscles are not able to control the body. Okay, that's why you will end up seeing the postural instabilities in this kind of kids. And there would be decreased movement, decreased spontaneous movement. As I said, the muscles are unable to perform against gravity, the muscles are unable to initiate the movement against gravity, and that's when you see the difficulty in the spontaneous movement. Basically, all of these factors together can end up having the child delayed in the milestone or delayed in the development. Are you getting it? So that's the commonest feature or commonest problems which the child with hypotonic hypotonic muscle tone, they will be facing. Okay, coming to assessing the child with hypotonia, I would say there are different methods to assess the child with hypotonia. If you want to say on observation, how you can, on observation, how you can say that this child is hypotonic. So that is a commonest finding that you'll see. The first one which I say, thumb in the palm attitude. Okay, that's the one. Second one is on observation, when you observe the child will look flabby. Okay, the child will show frog leg attitude. That means the abduction, okay, at the hip level, that would be very very much high that compared to the normal age match children. Okay, so there would be frog leg attitude where the hips are abducted and externally rotated. Okay, knees will be bent and the ankle will be seen plantar flexed. Okay, so that is the attitude and commonest attitude that is seen. That will be a pot belly, because the abdominals are also going for the hypotonia. So there would be a pot belly. The child will show with the protruded lips. Okay, if the child has oral muscles which has gone for hypotonia. Okay, if there is hypotonia for the eye muscles, the child will show extruded eyes, eyeball will be extruded. Okay, so this is the commonest features of a child with hypotonia. So on observation, if you want to say that this child has hypotonia, then this kind of attitude you'll be able to notice in the child. Okay, then coming to the next stage of the assessment, that is on palpation. If you palpate the muscle of the baby with hypotonia, the muscle will feel flabby. Okay, and it will be easily movable. There won't be some kind of a bulky feeling that should be coming from the muscle to have a normal tone or a normal resistance kind of a thing. So that muscle will feel very much soft and very much flabby kind of attitude. Okay, the next thing of the assessment, that is the examination part. So if you want to examine the child with hypotonia, then you can have fast passive movement assessment, in which you will see that the resistance is not coming, which should be normally coming from the normal muscles. So that won't be present in these kids who have hypotonia. Okay, so these are the commonest feature. One more important thing that I want to emphasize over here is there would be rebound phenomenon which these kids will be showing. What is rebound phenomenon? So when you try to move the limb or extremity of these kids, when you are performing the movement, at the end of the movement, the child cannot control, the child's muscles are not able to control against gravity, so there will be overshooting of that particular limb, okay, because the muscles are not able to control. That is the rebound phenomenon, and that would be seen in these kids with hypotonia. Okay, so briefly we'll come to the treatment part of hypotonia. So in the early stages, first of all, after the assessment, you'll categorize this hypotonia into three categories, like mild, moderate, or severe. Okay, depending upon the severity level, you will see the management. Okay, so what is mild? Mild is there would be just the problem with the initiating the movement against gravity. Okay, in moderate cases, the child would be there would be decrease in the tone for all the muscle, that is the axial muscle, and the central, that is the trunk muscle, the abdominal muscle, the core muscle, basically. Okay, so these muscles will be weak, or this muscle will show decrease in the muscle tone. Okay, in the most severe one, all the muscles, that is the peripheral muscle, the central muscles, all the muscles have gone for reduction in the tone, as well as the child will not show the movement against gravity. The child is not able to hold against gravity any movement. Okay, so these are the three categories that you will categorize into after the first assessment, your initial assessment. Okay, so when you try to discuss the treatment, you need to consider which category of the classification of hypotonia the child falls into. Okay, so I will brief out the hypotonia management from the beginning of the years. Okay, beginning of the life. Okay, so in the early stages, if the child shows low tone or poor resistance of a movement, then we can definitely start the early intervention, that is your kangaroo mother care. Okay, keeping the child over the mother's open chest, so that they share that connection and that warmth, and that again can be helpful in improving the posture of, or the security feeling that the child can get after that particular kangaroo mother care. Okay, the next treatment I would suggest is swaddling the baby. Okay, swaddling will again provide that comfort to the baby, and next thing that it will provide is it will prevent the extraneous activity or extraneous movement which is happening at the different joints. As I already said, we are seeing frog leg attitude in the child, right? The child with the hypotonia. So here, in the early stage, if we take care of a child with the swaddling, with proper swaddling, that excessive external rotation as well as the adduction can be prevented, and the child can have the child can have range of motion or the muscle strengthening in a particular ranges, so that this extraneous movement in the later stages can be prevented. Okay, this again, this swaddling can prevent this swaddling can be effective for the better sleep in the child, as well as the better growth. As we already know, if the child sleeps better, the proper CNS development can happen, and the child ultimately can have a proper growth and the development in the later stages of life, right? So again, this swaddling can be effective for both the ways, that is to promote the proper growth as well as to prevent extraneous activity or movements that is happening at the joints, right? The next thing I would suggest is massage. Okay, in proper pressure, with the firm pressure, if proper massage of the different muscles are being given in the child in the early stages, that can again improve the muscle tone. Okay, so for hypotonic kids, massage, firm massage, deep pressure massage, this kind of a massage is very effective following the swaddling of a baby. Okay, so these two treatments will go hand in hand, and it is found to be effective. Okay, another thing we need to focus is before the child turns age 3. Okay, that is the 3 years of age when the child crosses. Before that, that they encourage to participate in the proximal control or proximal strengthening. Okay, uh, I want to emphasize one important line over here is one thing that you all the therapists should keep in mind is when the proximal control is better, the distal control can develop more easily or in a more better way. Okay, so always and always in the early stages focus on the central control, that is the axial control of the body, in which you need to strengthen the core muscle, in which you need to strengthen the trunk musculature. Okay, so once the child gets the proximal stability, it is very easy to get the distal fine motor activity. Okay, so first focus on the gross motor activity or the axial control by different strengthening methods. Okay, this strengthening can be given in the form of in the form of positioning or in the form of use of a you can take bolster, you can take wedges, okay, different sizes wedges, and you can take some kind of the bozu ball, okay, that can be used, or the therapeutic ball, vestibular ball, that can be used to give different positioning, and that will help you to develop the central stability in the child. Okay, as the child ages, what you can give is you can give different positional activities which will focus upon the distal extremity control. Okay, and it will be more it should be more focused to improve the postural stability of a child, because in the early stages we are focusing on the gross motor or the central strengthening of a muscle. So later on in the later in the life, you should be focusing on the postural stability activity, which can improve, which can be activities on the bozu ball, or activities on the wobble board, balance board. Okay, these kind of activities can be trained in the later in the stages. If these childs are more prone to have joint hypermobility. Okay, so this child should be trained for mid-range control, okay, and the eccentric training, as they have a problem with the gravitational control. So eccentric training and the mid-range control is very, very important. Plus one more deformity or one more fluctuations that you will see, that the most commonest one is hyperextended knee. Okay, so that time again the braces can be given, okay, or orthotic support can be given to overcome that hyperextended knee, so that it cannot further damage the postural sequence in the child. Are you understanding? So these are the few points that we should consider when we are treating a child with hypotonia. Another thing which is most important, all the therapists will focus on the motor things of a child, but you should be training sensory wise also to this child. Okay, so sensory input such as quick stretches, tapping of the muscle, okay, and giving different kinds of a sensory input in the form of a vibration, in the form of a stretching. Okay, this should be given to the child, okay, in order to improve the facilitatory input to which are coming from the muscle, that should be improved at the peripheral level. That's when the central circuitry can be formed again, and it can be made more matured enough. Okay, so both the ways, the motor as well as the sensory development, both are necessary for this hypotonic CP. Okay, so when you are focusing on the motor part, I would suggest that it is mandatory to focus on the sensory part of a child also. Okay, the third and the important part of a management in the hypotonic CP, as I already said, these kids can have problem with the hypotonia of the oral cavity also. Okay, so there, with the use of finger, parents can be taught, or as a therapist, you also can be treating the child by giving sensory inputs. That is, giving the pressure, the deep kind of a pressure to the muscles of the oral cavity, with the use of a finger or with the use of a hand. Okay, and that could be promoted in the child always before the meal. That is the lunch time also and the dinner time also. Before the meal, that can be incorporated in the therapy session, or that can be incorporated in the be taught to the parent, done at home, and that will again improve the tone of a muscle of the oral cavity. Okay, so 3 to 4 sessions of this oral rehab that can be incorporated along with your or sensory motor rehabilitation of the hypotonic CP. Okay, so these are the few things that you need to consider when you are taking care of a child with hypotonia. Okay, I hope you liked it and this was informative enough. uh, yes, it is a short topic and a short conversation, but for more details you can always check my blogs where you will find all this information in detail. That is on tinyyears.blogspot.com. Thank you.
Wonderful, wonderful.